This podcast is brought to you by MHA of Dutchess County and produced by CMJW Entertainment. This episode of The Vital Women of Washington Heights is proudly sponsored by Livia Med Spa. The Vital Women of Washington Heights presents Beyond Hot Flashes and High Heels Fashion Show, a night to mingle and embrace the beauty and power of being a woman. The event takes place at the Salt Boutique Labs on 70 East Main Street, Wappingers Falls, on Thursday, December 4th from 6 to 9 p.m. The night will include an inspiring fashion show, hors d'oeuvres and specialty cocktails, local vendors, and more. Not to mention, I'll be DJing. You can go to the link in the description or visit the QR code on your screen to get tickets for this fashionable and festive event.
Hi, everybody. This is Andrew O'Grady, CEO at Mental Health America of Dutchess County, coming to you from our new MHA studios, where Connor Walsh is now producing all of our social media. I'm so happy to be here, and we're going to be right here in this spot this Monday, November 24th, from 2 to 4 p.m. Michelle Barone and I from Red will be sitting here. We're going to have guests on for 2 hours, and we're going to be holding a telethon. We're going to be raising money, or videothon, I guess. We're going to be raising money to fund gift cards for our clients here at MHA who can't afford food for the holiday season. So I'm hoping that you tune in, you put a little thing in your calendar and check us out live on that day. There'll be a way for you to donate. And if you see the feed, if you're sitting home and you're at work, you see the feed, share it. Share the live feed on your own, so we can get this word out and people can watch our show and hear what's going on, and you guys can all help out and make a donation. And we're gonna make a lot of people happy this holiday season because of your help. So please help us out. Look for us on Monday, the 24th, from 2 to 4. Hope this holiday. Support Mental Health America. MHA's annual wreath sale is back. Support Mental Health America of Dutchess County this holiday season by purchasing a beautiful, fresh wreath for only $30. Please pre-order by November 19th to guarantee availability. Orders accepted while supplies last. Order online at mhadutchess.org/wreath or call 845-473-2500 extension 1391 to order or schedule delivery. Happy holidays from MHA of Dutchess County.
You're listening to The Vital Women of Washington Heights.
Hello, everyone. My name is Iris Douglas, and with me is my co-host Yvette O'Sullivan.
Hello, everyone. I hope you're having a beautiful day today.
We are happy to say that the Vital Women of Washington Heights living in Dutchess County has the Commissioner of Health here.
The Health Commissioner.
The Health Commissioner, yes. Doctora Livia. I don't want to mess this up, girl, because I don't. Santiago-Rosado, welcome. We're so happy to have you here. We met you when we went to
the walkway over the Hudson during Cancer Awareness Month.
Yeah,
that's right, breast
cancer awareness month. Yes.
And it's lovely to be here. Thank you so much for having me.
You're
and I'm always
welcome.
Excited to talk about our health department and all the great work that our staff does every single day. So thank you.
Thank you for joining us today.
Yeah, we're super excited about that because, as you know, we are all about the community. We're from Washington Heights, and it's all about building that community within the community to make sure everyone is safe and sound and healthy and aware and educated of what's going on, So talk to us. Oh, wait, you got your bochinche
I have
first.
my bochinche.
Wait, doctora,
We can't start before,
got a little bochinche
Dominicans
going
and Puerto Ricans, when they get together, there's always un bochinche.
Siempre hay un-
Bochinche, very important.
Very important
sometimes.
But my bochinches are based on research. So I'm always curious as to what's happening in Dominican Republic. And I was like, I wonder if they have a health commissioner in Dominican Republic. They do not have a health commissioner, but they have a minister of health that runs, I guess, the whole department and has different people under his role. Mm-hmm. So that was new for me to learn.
Cool. Wow, that's pretty cool. That so is a man that runs this? Like he's running the whole thing that's going on?
It's a man running the whole health department in Dominican Republic. And here in Dutchess County, we have a female, which is awesome.
Well, I'm really happy about that. And it's so funny, a little bit bochinche about Santo Domingo, because I was talking to my sister today, and this is very interesting. And it's a little off the topic, but it's kind of in the topic too. When children are born in Santo Domingo, they have to be announced. And sometimes it takes about 2 or 3 months for them to be announced according to when their birthday is. So sometimes I feel like, are we, like when you just said about that there is a commissioner, I'm happy to say that because Santo Domingo can be sometimes a little primitive. And I feel like, is that still happening where people were born in April and then they're announced that they were born in August? You know what I'm talking about.
I know they did that years ago, like with my one of my relatives' birth certificates, we were just looking at it not too long ago, my daughter and I, and he was born in April, but he was announced like 2 months later. I do not know if they do that currently.
Yeah.
I hope they have progressed. And I don't know if that is the parent that delays
Yeah.
going to announce the child or to do the paperwork. Unlike here, that as soon as the baby is born, right away they come to you in the hospital. So I'm not sure what the
Yeah.
system really.
Yeah, I've heard of similar stories. In fact, I've heard of stories where somebody has two birthdays because they have their real birthday and the date that they were registered. And even, where they have more than one name because mom said, we're gonna name this kid whatever name, and then the dad goes and registers the kid and changes the name. So
Yeah.
strange,
Yeah.
but I don't know if that's still happening. Again, these are people that I know that are older, but
So I'm happy to hear that there's a commissioner of health because I think that's very important. So in the Heights, we used to go to 165th Street, the medical center, Columbia Presbyterian, and there was a little health, like where you used to get your shots and stuff. So is that how important it is for us, the community, to know where to get your shots, where to get your, any flu shots you need, any vaccinations, or where to get help when you need like a mammo or a pap smear? How important is that for the community?
That, if you don't mind,
No,
that is
it's
a great
okay.
question,
It's okay.
but
I'm
I would
sorry.
like our audience to learn a little bit about Dr. Livia,
I'm sorry.
her background,
Yes,
your
yes.
ethnicity,
Sorry about
where
that.
did you go to
I jump always.
school? So please give us a
Yeah.
little bit of
about me.
about you,
Yeah.
so we can get to know
Yeah.
you better.
Sure, thank
Thank you, Yvette. Sorry about that.
So I was born in Puerto Rico, actually, and I moved here when I was about 11, right at the beginning of 7th grade. But not here, not New York, actually. I think a lot of Puerto Ricans sort of assume, oh, it must be New York.
Yeah.
But actually, we ended up in Providence, Rhode Island, of all places.
Wow.
So I grew up in Providence, went through high school there, and then went to Harvard for college. So for that period, I was living in the Boston area. And then the reason I came to New York was to actually go to medical school at Columbia. So right there in Washington Heights, right there in the neighborhood. I absolutely loved my time in medical school, in part because I was living in a Dominican barrio, right? And I had access to food that I recognized as familiar. And, I could go out and kind of blend into the neighborhood, even though I was a medical student. A lot of the other medical students couldn't really blend in, but I felt like I really could. So it was a great time there. And then I did my internship and my residency. I did my residency at Mount Sinai, which you do part of your time at Mount Sinai in Manhattan and part of the time at Elmhurst Hospital. A lot of people are more familiar with Elmhurst post-COVID.
It's in Queens, right?
It's in Queens. It's actually the most diverse zip code in the country, probably the world.
Really?
Yeah, there's something like 250 languages spoken within
Wow.
a 5-mile radius or something like
Interesting.
that.
That's pretty amazing.
So I absolutely loved my time there also because, those are the lessons of being able to talk to anybody and, try to figure out how to communicate, try to figure out how to educate people. Because really that's a lot of what medicine is and healthcare is. I ended up practicing in emergency medicine. So my residency was in emergency medicine and I practiced emergency medicine. I've been practicing for 20 something years. I very quickly realized that what I enjoyed the most was actually leadership positions, and not necessarily because I like to tell people what to do, although there's a little bit of that. But
funny.
primarily it was because I felt like when you're in a leadership position and you're in a position to make policies, you can actually have an impact on so many more people than on the one-to-one patient care
Absolutely. Totally
relationship.
get
And
that.
as much as I enjoy the one-to-one and as much as I like talking to people and individuals and families, I just felt like you could really multiply the impact and the improving a lot more people's lives than just the one patient you have in front of you. So that was always exciting. And in a way, it's sort of also predicted my transition into public health, where instead of having one patient at a time, we really are thinking of the whole population as our patient, and thinking about within that population, how can we prioritize certain things? How can we make sure that, we are thinking about prevention, thinking about health promotion, engaging the community as a whole. Because again, there's only a few of us. I mean, our department is 100 and almost 120 people. But when you're thinking about, making an impact on a county of 300,000, it's really this is where it becomes really important for us
Yeah.
to collaborate with others, including doing things like this, so that we can have more of an impact even and more of a presence. So that's a little bit about me. I guess on the personal note also, I'm married to another emergency physician who was my classmate at Columbia.
God, look at you.
Yeah, it was like one of
College
those,
sweetheart,
like,
right?
you start med school and you meet the person
Love
you're gonna
affair in
marry.
Washington Heights.
Yes, it was. And then, and we actually did, we both did residency in New York City. So we got married during residency. And now we have 2 children. I have a daughter who's now in college and a son who's a
awesome.
junior in high school. So that's me in a little nutshell.
Yeah.
Well, thank you so much for sharing that. And going back to Iris's question, how do you define the health department and what do you guys do there exactly?
Yeah, so we are, the Dutchess County Department of Health is one of 58 local health departments in the state of New York. Almost every county has their own health department, not 100%, but for the most part, that's the case. Larger counties like Dutchess County, Dutchess is considered a large county in New York, have commissioners of health. So a commissioner of health must have a doctorate in, must be a physician, and in addition, either have a master's in public health or have a background in residency training and board certification in preventive medicine. So that in my case, I got my master's in public health, and so that's sort of how I became commissioner. However, so different counties are slightly, may vary a little bit from one county to the other in terms of how they're set up. But I think I would safely say that, for the most part, health departments across all these different counties and even outside, and when you go to other states, are focused on very similar things. The core public health services include things like immunizations. You talked about vaccines, so that's a really important prevention portion of our work. We are focused on communicable disease control and prevention, right? So think about our involvement, of course, with COVID. We are involved in environmental health in very small counties because they're, maybe resource constrained. They may use the resources of the state health department to manage their environmental health. So when we talk about environmental health, this is a lot of sort of the basic things that you don't even really think about that much as being health related, but absolutely are. So things like clean water, clean air, food that's being prepared appropriately and with regards to, safe handling and preparation techniques and storage. So we have a whole section of our department that's environmental health, and these are incredibly hardworking sanitarians and individuals that go out to make sure that the water's clean and the public water systems, that the restaurants are doing the right things in terms of, doing what they need to do. We also have engineers who make sure that things are being built properly, right, to support health, and that we have mitigated the possibility of contamination and things like that. So that's really a lot of that core public health work. In addition, health promotion and health education are super important to us, and in particular because we recognize, and the state of New York, the New York State Department of Health, under which we not under which we work, right? So we are under the county government, but we have sort of dotted lines to the state Department of Health, and the State Department of Health has been very clear that one of their goals is to eliminate health disparities. When we talk about health disparities, that's really thinking about how different parts of the population, different pockets of the population may have worse health outcomes than others based on perhaps where they live or what kinds of social circumstances they have surrounding them. So those are items that we're definitely focused on as well. Chronic disease, coming from a data perspective, is again one of those things that we're really concerned about because that's what's causing premature deaths in our county. So a lot of prevention, really a focus on prevention, and also a focus on safety net. So to your point also earlier, when people don't really know where to go or what to do, perhaps people don't have access to certain potential health services, that's when we come in, and that's when we're there. So I can talk more about that. But
Yeah, I'm happy to hear that. And I have a question regarding the immunization because my daughter called me today, literally right before I came. She says, "Mommy, Athena went for her exam, and I prolonged the immunization. I don't know if I should vaccinate her. I need to do my homework. I'm going to do a little bit more research." How do you feel about that?
Yeah, I mean, it's I don't want to speak to
No,
her situation
because she wants me to guide her
specifically,
as
but
well. So I want to know what are the pros and cons, because that's important for me right now. Because she's like, Mom, I need to know. I said, well, as a matter of fact, I'm going to be talking to someone
Yeah.
today.
But to add to that, tell Dr. Livia that Athena is Iris's
Oh, yeah, my
granddaughter,
granddaughter.
her
Thank you.
2-year-old granddaughter. However, she doesn't live in New York State. She lives in Florida.
Oh, that's
So
right.
I'm not sure. Are there differences when it comes to the vaccination between Florida and New York?
so the main differences would be in the ability of the child to attend school.
Oh, okay.
So in terms of Florida and New York, Florida has a lot of potential exemptions for parents to who object to the regular vaccination schedule. So they can sort of go around that. New York is a lot more strict. And so there are no, the only allowable exemptions for a child to be able to attend school would be a medical exemption. So if a child has had, a very severe reaction to a certain type of vaccine, they might be sort of exempted from having to have another dose, for example. So New York, the mandatory vaccines are really related to school attendance, to being able to attend school, and that includes most schools, even private schools as well. So part of the reason is that for those kids that do have those valid medical exemptions, it is super important that their classmates are vaccinated because they are not able to take a vaccine. And so if another child who may have, no medical issue, but, may be exposed to a disease, now brings that disease into the classroom where that child who has no protection may be exposed, then, that's the problem. As far as the schedules, the schedules have been well studied and have been promulgated by the American Academy of Pediatrics, the American Academy of Family Physicians. I know that there's been some concern expressed by parents about certain timings. But the guidelines have been developed for good reasons, right? And they've been well studied. And so we do have good evidence that even sometimes it seems like, you're getting 3 or 4 shots in one day. Is that too much? The evidence seems to show that it's not too much, that most kids do very well with that. And there isn't really a lot of evidence to show that it would be harmful. I know that recently there was a change that was implemented nationwide by the American the Committee on Immunization Practices, part of the CDC, where they did make a change to the MMRV recommendation. So that's the measles, mumps, rubella, and now varicella, all 4 in one product. So they've made a recommendation to kind of split those for the first dose and then to give them together for additional doses. So there's been a little bit of separation. So they're still looking at the data as it's coming out to see, what kind of makes sense.
Thank you.
Sure.
I think that's a good recommendation, maybe to spread it out. Because I think sometimes parents get nervous when they say, well, they're getting 3, they're getting 5 different immunizations at once. And I can understand where that,
That's
nervousness
exactly
comes
what it
from.
is. That's exactly his mom. She's like going to get sick. She doesn't do well when she gets all these shots together. So,
So I think it's important to think about, a lot of the reasons that people sometimes want to sort of wait is needle phobia. They don't want the kids to literally get that many pokes, but a lot of these products are combined. So it's still one shot. It's just that you're getting multiple products together. But, again, I think it's important to, in my world, it's really important to sort of listen to the best available evidence. And certainly the guidelines that are currently published are based on the best available evidence. Does it mean it's going to be the best available evidence in 5 years or 2 years? Not necessarily, right? And that's the beauty of science, is that science requires that we be vigilant and open to what the science and what the actual data are telling us. And if there's data to say, well, maybe we can split these up, great. But if not, I think there's also a lot of evidence to show that when people get the shots together, there's a lot more compliance. So people are more likely to sort of complete all the things that they need to complete.
That's
which
true.
is, again, really important when we're talking about how we protect each other, because at the end of the day, we're still in community, right?
Absolutely.
That's right.
Absolutely. And that's more important.
Thank you for
Thank
that.
you so much for that.
Can you tell us a little bit about the STI program that the health department offers?
Sure.
I don't think a lot of people are aware that you offer that service.
Absolutely. So, and STI, for those who may not know, sexually transmitted infections, right? So that is a kind of an offshoot of our communicable disease program. And so focus specifically on those sexually transmitted infections. There are alarming rates of transmission in Dutchess County, and for women, particularly young women, chlamydia cases are through the roof. A lot of gonorrhea going around, and perhaps most tragically, we have seen increases in the rates of syphilis, a disease that had been eradicated as of the year 2000 in the state of New York.
That's interesting.
So there were 0 cases for several years in the state of New York of syphilis, and now, unfortunately, it's coming back. So we are seeing, and the really terrible thing about syphilis is that it can cause congenital syphilis. If a woman who's pregnant contracts the disease, she can pass that on to the fetus, and then the fetus could be affected and even potentially die as a result of that infection.
Correct me if I'm mistaken. And also, if syphilis goes untreated, does it affect you eventually mentally in the long run?
Yes, it has a lot of really dangerous effects. A lot of, people with advanced syphilis can absolutely die from it. So it can affect the heart, it can affect the brain, and it has it can affect the joints, a lot of different things. But, of course, we're mostly concerned about the brain and the heart. But again, and part of what we're trying to do is really address the transmission, because while healthcare takes care of the individual that may be infected, we as a health department are there to try to interrupt the transmission of the disease. And so we are looking at how do we get more education out there. Back in the 90s, when I was training, we had HIV, and as a result of that, people started really paying more attention to the idea of safer sex and using condoms and things like that. And so it was sort of in that time period where we saw syphilis really start dropping off. And we saw those numbers go to 0, sort of in that environment.
But that's interesting, because I used to work at a doctor's office. Well, ever since I was like 14, people used to have to get tested for syphilis before they got a marriage license.
Yeah.
That's how long ago that was. I remember people coming, they had to make sure that they were negative before they even got married.
Yeah, the problem is that even if they got married, there may still be transmission, right?
Yeah,
so
exactly.
I actually had to get a syphilis test before I got married. I got married in Puerto Rico, and it's still a law there. But, with syphilis, unfortunately, the rates have been coming back up. I think part of what happened is now we have great medications. Thank goodness, right? I mean, these are great things, great medications for HIV that can not only treat the HIV if you contract it, but can prevent the transmission of HIV. And I think a lot of people who might have avoided engaging in high-risk sexual behavior in the 90s or early 2000s now feel like, oh, maybe they can because they have access to these medications. Unfortunately, those medications do not prevent the transmission of all these other diseases. So what we're seeing is increasing rates in these other diseases, even as HIV has remained flat or is dropping. And unfortunately, so what we offer as a health department is we have our public health advisors, who are the ones who investigate any cases that we have. So whenever we have information that there's been a positive case in the community, particularly syphilis and gonorrhea, we call the individual, our public health advisors call the individual, try to get a sexual history to make sure that we can contact any sexual contacts that that individual may have had, to try to make sure that we get that person treated in case they may be infected as well. We also offer the actual treatment, the diagnosis and treatment services in our clinic. The Department of Health's clinic is located at 29 North Hamilton here in the city of Poughkeepsie. So it's open, 5 days a week. In addition, we offer similar services through our mobile health unit, which is a huge 39-foot RV that we take around
I'm excited
the
because Yvette was dying to talk about that mobile unit.
Yes,
Trust me.
I'm excited to hear more about the
Yes,
mobile
we are
unit. But
excited.
before we move on to the mobile unit, is there data showing the age group
That's a good
of
question.
who is contracting STI?
It's a little bit of everything, as perhaps you might expect. We see a big numbers in chlamydia in young women. Chlamydia is much more likely to cause symptoms in women than it is in men. So even though the men get it too, they don't necessarily show up for testing or with symptoms. So our numbers are reflective of who is actually getting tested. So young women, under 30, somewhere in the teenage years to 30, very, very high rates of chlamydia. Gonorrhea, more in like middle-aged men, like men in their 30s, 40s. But again, we see a spread. It's
Right.
sort of everywhere. And syphilis is a little bit of everything. But we are, again, most alarmingly seeing it in young women. It used to be an infection that we were seeing more in the early 2000s, 2010, the last decade, more in the population of men that has sex with men. But we're now seeing it, kind of spill over to the heterosexual population. And again, that's the concern with congenital syphilis specifically.
So, doctor, let me ask you something. When I went to school, high school, Washington Irving High School, we used to have a class where they used to talk about syphilis, and they used to talk about, sex and all of that stuff, and how to prevent it, how to take care of yourself. Teenage girls, it was an all-girls school. Do they have that in schools now, where they go and the counselor and they talk to these kids about taking care of themselves and being healthy and not getting syphilis?
As I understand it, so there are health curricular standards for every school district. So it's being taught. But like anything else, right? The quality of that information and how it's getting to the kids is, it's going to depend a lot on what kind of teacher you had and were you paying attention because you were bored by the teacher or engaged by the teacher. I think also, the environment of health class can be, people get the kid. I say this because I have teenagers, of course, so I can say this in particular. But they'll start to get silly and then maybe not paying attention. Teenagers, people in general, but teenagers specifically, are not great at seeing themselves in the future.
Right.
And so there's a lot of that teenage, like, well, it's not going to happen to me, like, or oh, it's just this one time, or so. And again, I don't mean to poo-poo on teenagers because I think we all do this, right? We try to think, oh, well, that's going to be someone else, or it's going to be fine this one time.
Well, to your point, I mean, when I was 16, I wasn't thinking about menopause, and that's what I'm going through. So
that's right.
Yes.
You don't see yourself in the future, right? And you never see what's really going to happen. So
you don't. So I would like to ask you about tick-borne disease. And to me, this is a very important question because in 2009, when I used to do, and of course the word is escaping me now, but we used to go to the park to work out, the boot camp thing. And I got bit by a tick. However, I never found the tick, but then I developed a bullseye on this shoulder. And not only was it Lyme's disease, but it was babesiosis.
Oh, babesiosis.
Babesiosis. I never know how to pronounce it correctly. And it took me a long time to recuperate from that. I hope that things have improved since 2009. Can you tell us a little bit about how the health department deals with tick-borne disease?
Improved. It's certainly gotten worse. Wow. So we're seeing a lot more tick-borne illness and a lot more positive ticks whenever the state, that we don't do this in our department, but the state that goes and like samples actual ticks and then test them to see, what kinds of diseases they may be carrying. So one of the things that we're seeing is that with changes in climate, for example, we're seeing warmer temperatures and, mosquitoes and ticks, their habitats used to be a lot more constrained, right? Because of the cold, the snow, but now we're seeing a lot less of that. And so the ticks are staying active for more of the year. It used to be that you could probably kind of be like, you're fine from, say, October to March. That's no longer the case. We're seeing transmission and biting even into November, December, and starting as early in some cases as February, March, April. So, what used to be a shorter season that you needed to be concerned about is no longer. So that's part of the issue. So we're seeing Lyme disease, babesiosis, anaplasmosis is another tick-borne illness, and ehrlichiosis is another one you may have heard of. So there's multiple ones. And then the other one that I always kind of warn people about also, because it's not spread by the typical deer black-legged tick. It's actually, for the most part, spread by like these Lone Star ticks, but sometimes even by like dog ticks. It's called alpha-gal syndrome. I don't know if you've heard about that.
I haven't heard about that one.
So it makes you allergic to beef or meat, like pork.
Sounds dangerous.
And we actually just had last week the first death as a result of the alpha-gal syndrome in a man in New Jersey. So that had not gotten to an anaphylactic sort of situation before, but now, or at least resulting in death. But we just had a death kind of come up. So it's certainly something to just be concerned about. Ticks in general. Like if you see a tick on you, you know, one of the things that our department does is huge campaigns to get tick removal kits out in the community. Everybody loves our tick kits, and so they come with a magnifying glass and that are attached to tweezers, so and instructions on how to pull it out properly. Make sure you get the head out, and try to make sure that you get it out before it gets engorged, right?
Well, that was my situation. The tick never got engorged, and that's why I've never noticed that I got bit by a tick.
And
until
maybe
I
you might not have gotten bit. Did they tell you that, by the way, that where you get the rash is not necessarily where you got bit?
Yes.
So that would be one thing. Yeah, I mean, so for the most part, it may not have been huge or engorged, but for the most part, when we're seeing transmission of these diseases, the tick has been attached for at least 24 to 48 hours, and sometimes even longer. So typically what's recommended is that if you're not sure, and it may be, you know, in that 24 plus hour mark, that you seek medical attention so that you can receive prophylaxis. There's an antibiotic called doxycycline that, as long as you're not allergic to it, is pretty much safe at any age. And even one dose of it can prevent transmission of a lot of these illnesses. Not the alpha-gal, but it helps.
Well, thank you so much for that. Now we can move on to the mobile crisis, units, the mobile health unit.
Sounds to me like you're super busy, girl.
My days are very busy, but I kind of like it. They go quickly.
I love it. Oh, well, but you're serving, so it helps, you know, you're serving the community. So we definitely want talk to us about the mobile unit, because we are excited about that. We talked to you about it briefly when we met you, but share.
It's the coolest. I'm very excited about it. Our mobile health unit is, as I mentioned, a 39-foot RV that has been, you know, outfitted, specifically built to be a clinical space, a space where we could do health education. And so we have, in particular this year, really taken it out around the county and thinking about how do we meet people where they are, quite literally, is getting it out to areas of the county that we know are underserved, where there may be difficulty for people to access services, especially if they lack transportation. But even if they have it, right? Sometimes it's just that the services are so far that they may not really be able to, you know, get here before after work or something like that. So that's been one of the things that we really tried to do, is establish a particular cadence so that people can predict when we're going to be in their area, and that way arrange to sort of meet us when we're going to be there. Well, we've tried to partner, again, doing a lot of partnership with community collaborators, because what we discovered is, as I like to say, we're not that sexy. And so you know, if we just go somewhere and we advertise the mobile health unit's going to be there, we may not get as much uptake as we do if we coincide with something else that's already going on that people know
you have
about.
to partner up, because that makes it better. Absolutely. And then people come.
So what we've done is, you know, finding, for example, food pantries, because we know they're going to draw a little crowd. And in addition, it is precisely, a lot of times, there's the Venn diagram is almost a circle, right, of like the people that we're trying to find in these underserved areas, to make sure that they're aware of their resources that are available to them, to directly potentially provide some support in terms of healthcare. Those are also the people that may have food insecurity and that are going to be on the line for the food pantries. But also, in addition, you know, anybody who just happens to be walking by. So part of what's kind of beautiful about this vehicle is that it's, you know, it's huge and it's colorful and it's beautiful. It's a very attractive.
People get curious. People get curious. Yeah.
It's almost like I call it a traveling billboard, right, about our services. So it really has been a great way for the community to get to know us this year. We're really excited. We're kind of parking it now, because as the winter's coming, it doesn't really like the ice, as you can imagine. This
especially when you service the east side of the county.
Yes, those little hills and mountains, getting down into Pauling and Dover and Amelia.
Pauling is hard because it's mountains.
Yes.
We know. We go to Pauling.
Well, you provide the mobile health unit for our friend Ingenia Jackson, that she is the founder of Camino al Éxito.
That's right.
And the people that she serves are very excited, because they don't have transportation, and it's very difficult for them to receive medical care.
That community is definitely challenged.
Yes.
Yvette and I are part of that organization, and we love working with her because she is all about community. So I'm glad that you guys, are collaborating together. It's exciting to see like how do you educate the people that you're there and you have this service? How do you make announcements? I mean, do you do it like through social media?
All of the above. Yeah. So social media, school districts,
Okay,
our
that's good to
partners
know.
that are in the area, elected officials, anybody we could get the word out.
Okay.
We've developed flyers. We put them in the delis. We try to really get the word out as much as possible. And it's, it seems to be working in terms of, potentially drawing the people out. But the main thing is exactly what you said. We're there, even if we can't really help you from a clinical perspective, we're there to educate and connect you to resources. We are, very good about finding what organization is working on what, and how do you connect with them, and what might, how could the public, trying to speak to the public and talk to individuals and figure out what is it that you need? What is it that, you need to know about? We find, for example, mothers whose immigration status may be unclear, but who have children that they haven't really sought medical care for their children. And we're like, no, your child can absolutely go seek medical care. We want that child to make sure that they're taken care of. So part of what we do also is to educate the individuals that we're meeting out in these communities, so that they do connect with these services. We don't necessarily have to be the providers of the service, but we know what's out there. And a lot of times we're able to connect people to those resources. So
That's important. That's very important.
What would you say is your call of action for the community in general? How can we support better health? How can we support the health department? What can we do as regular citizens?
Yes,
I love
that's
that
a very
question.
good question.
Yeah. So I would say that, in our environment in this country, in New York, a lot of when we think about health, it's like equals healthcare. And I would challenge you and everybody to think of it a little bit different. Health is not healthcare, right? Healthcare supports health, but it's not equal to health. And I think it's really important to think about health as being something you protect, you promote, and you can prevent, the things that can impact your health. So to me, one of the things would be to really think about, when we're talking to elected officials, when we're talking to the powers that be in the world, I think, a focus on prevention and on health promotion is really important, because I think we spend a lot of money, a lot of energy trying to fix things after they're already broken.
Absolutely.
And also people are suffering because they're broken, right? And so are there ways to, kind of pull back and think about preventing that, rather than wait till somebody gets diabetes, thinking about their nutrition now, from the time that they're children, so that we can build more resilient bodies that will not be as likely to then end up with diabetes, right? And then we're not dealing with the kidney disease and the blindness and the heart disease that can ensue from the diabetes. So it's really thinking about health a little bit differently, and then having conversations to advocate for the things that can really help, which I think, and if started at a young age, I think it's going to be super powerful in terms of transforming, our communities. So that's something that we're really excited about. We do have a Fit Dutchess project that we're trying to engage people in, and that is really focused on prevention through nutrition and physical activity for children and youth, and building opportunities so we can essentially create a more resilient and healthier population from the outset, instead of, again, trying to treat it after illness has already taken hold.
Hello.
What you say, girl?
And then treat it after it's done.
Superman doesn't want to be up there.
Well, what you're saying must have been very powerful, that it just knocked the wind out of the shelf.
I used to work for a company called Life Extension Institute, and that was their focus on preventing diseases.
Yoga.
I'm not cutting this.
Yeah,
That's staying in.
that's
Well,
why I do
our
yoga.
audience
I'm
does not know
62.
what happened.
I'm 62 years old. I do meditation, yoga, and practice a lot of energy work.
That's great.
Yeah, thank you.
The shelf at the new office just collapsed.
That's okay. Hey,
I think
it's
that
like
was-
saying, welcome,
woke
Vital
us
Women
up.
of
I think it
Washington
woke
Heights.
us up.
That was our
That's it.
That's our welcome. And
Powerful
welcome,
women
Doctora
for
Livia.
Washington Heights.
All right, I ain't trusting that anymore.
Yeah.
somebody upset at what I was saying. I don't-
Yes.
So I have a question for you. What inspired you to be who you are and want to serve the community the way you do and educate yourself so well to make sure that you became that leader? Because that's muy importante.
Good question.
Thank you.
What inspired me? I mean, I think I always say when I was in high school, I did some volunteering in a hospital. And what I realized was that they were calling me all over because I was originally supposed to be a candy striper and like fill up like water bottles and stuff. But then they realized that I spoke Spanish. So very quickly, this was back in the late 80s.
Yes,
So very
imagine.
quickly, they gave me a pager back in the day, a pager. So whenever I was there volunteering, they gave me a pager and they would call me from all over to go and interpret for Spanish-speaking patients. So I was 15 years old, and here I am getting pulled all over the hospital, in the
Candy
OR,
striper.
in the ER, and on the floors, all over the place to do this interpretation. And what I realized was what I loved the most was the emergency department. And the reason I did was because it was the place where it didn't matter how rich you were, how poor you were, it didn't matter what your ethnicity was, it didn't matter anything. Your age, how much you knew, how much you didn't know. That's where it's a very sort of democratizing place where everybody's treated the same. And that was really an inspiration to me of how I wanted to sort of approach my career, was that I don't subscribe to these ideas like, oh, you have this background, so I'm going to be respectful to you, but not to you. Like, I really feel like I love helping everybody. I love, sort of lifting all the boats. It's like that tide that lifts all the boats. So from that perspective, I think that's what inspired me, like I said, to move even from the direct patient care, the one-to-one, to really want to do more, because it was more satisfying and it was more exciting to me to think like, oh, we just implemented a really good policy that's really literally going to help not just my staff that works for me and the staff from the other departments, but all the patients that come through. And that's sort of what I have tried to focus on as my career has progressed, is having as much of an impact, trying to improve people's lives as much as I
love
can.
that you're approachable. And that's what we liked about you when we met you on the walkway over the Hudson, that you were so warm to us, and we were standing there talking for 30 minutes. So thank you for being so approachable and for just being, so welcoming and warm personality. And due to that, are we going to announce that Dr. Livia is going to attend our Beyond Hot Flashes and High
yes.
Heels fashion show?
So, ladies, we got a fashion show
And she's
going
going to be the
on.
keynote speaker?
We got a fashion show going on, if you don't know that. And Dr. Livia is going to be there, and it's going to be amazing because, women are the CEOs and CFOs of the family. And just to have you there, just whatever comes up, whatever questions, whatever you want to talk about, it's just going to be an impact, to unpack something that somebody needs to know at that time. It's going to be a wonderful exchange of women empowered, just kind of having fun, showing some styles, and just kind of just being playful, actually. But we have, Dr. Livia that's going to be there. We also have a up-and-coming designer from Wappingers Falls. Her name is Sky. Beautiful, beautiful girl. And we have Yvette, of course, talking about menopause.
Talking about menopause.
Talking
You got to
about
have that conversation.
The heat. And you have me talking about whatever. So I'm excited. Please just take a peep. We're here. It's going to be in a beautiful place. It's an amazing space. The Salt
Boutique Lab in the village of Wappinger Falls.
Yeah, with Dr. Rihanna.
Dr. Reina.
Dr. Reina. And, Dr. Reina, sorry. And she's amazing. She's beautiful. She's got a beautiful staff, and it's all about educating women on how to stay beautiful and how to stay zen within as well, and how to show your style. So, yeah, come and join us.
Yes.
Yeah.
So with that being said, we're going to conclude our show. Thank you
Yes,
so much
thank
for
you,
being here
Doctora. Appreciate
with us
you.
today.
Yes.
I really appreciate it being here. Thank you.
Thank you.
And thank you so much to our producer, Connor Walsh, for always keeping us laughing.
Yeah, and our sponsor, Mental Health America. Thank you so much, Andrew O'Grady. We do appreciate this wonderful space that you are providing for us so we can educate. Thank you.
Thank you.
This podcast is brought to you by MHA of Dutchess County and produced by CMJW Entertainment. Thank you once again to this episode's sponsor, Livia Med Spa.